So we have
Yes,
we
ma'am.
had several contestants for the Yuva Oration, which was selected at the Yuva ISAR, and this oration has been instituted by Dr. Jaideep Malhotra. So it is the Jaideep Malhotra Yuva Oration, and we have Dr. Sumavarsha, who is a consultant at 49 Hospital Vijayawada, and also a former assistant professor at SVIMS Tirupati. So she has won this oration, and she would be talking to us on fertility preservation.
So, at the outset, I thank Dr. Jaideep Malhotra ma'am for conceptualizing this Yuva oration and giving me this wonderful opportunity. I'm extremely humble. I thank the organizers. Fertility preservation today, the need is real. Reproduction is essential for persistence of life, and it is the right of every individual. But there are certain instances where people, though they are potentially fertile, face certain obstacles where they may end up becoming infertile. I'm just quoting a few examples. Mr. and Mrs. A were devastated to find that their 16-year-old son was diagnosed with lymphoma. As they were getting to terms with the diagnosis and figuring out the treatment options, they were taken aback to know that the treatment might end up with their son becoming sterile. Miss B was at the peak of her career who was about to kickstart a job in her company, but her excitement did not last long when she was diagnosed with breast cancer. Soon she would be sick, and who would want to marry a girl who would eventually be infertile? Miss C was a 20-year-old student suffering with an autoimmune condition called SLE. As the regular immunosuppressants were not working, she was given certain chemotherapeutic drugs which would eventually deplete her ovarian reserve, and she was also staring at infertility right at its face. Mrs. D was a 26-year-old, recently married, diagnosed with melanoma. This seems to be a full stop to her aspirations of a fairy tale married life, when she would ideally be bald and probably infertile as well. Miss E was a 30-year-old model. She was at the peak of her career with many bright opportunities. Marriage was not on the cards in the near future, but she always wanted to have a big family when the time was right. Now, these are a few instances with people from different walks of life, from a child to an adult, unmarried, married, limited by disease, or living by choice, who wanted to preserve their fertility against the threat of age or disease. So, fertility preservation is the application of medical, surgical, and laboratory procedures to preserve the potential of genetic parenthood in adults and children at the risk of sterility before the end of natural reproductive lifespan. So it's not just indicated for cancer treatments like surgery, chemo, radiotherapy, but also in certain benign conditions like bilateral oophorectomy in BRCA positive, or autoimmune conditions, or severe endometriosis, surgery for that, or in certain genetic problems where they may end up with premature ovarian failure like Fragile X or Turner's, or even in males who may become azoospermic with Klinefelters. And social egg freezing has now empowered women to embrace motherhood whenever they want it. So the war on cancer has been an offensive one, and cancer no longer is an acute death sentence, but people now live for an extended period of time. As per the National Cancer Registry of India, 1 in 9 people likely develop cancer, and 1 in 530 people between the age of 20 to 39 are actually childhood cancer survivors, which is a staggering statistic. So earlier detection, aggressive radiation therapy, and newer chemotherapeutic drugs have increased the survival rates among cancer patients, which further emphasizes the need for fertility preservation. So now cancer is no longer a death sentence. It is a life-preserving but a fertility-threatening disease. So it could be because of a surgery where you have to remove the gonads, or a chemotherapy, alkylating agents being the most gametotoxic, or a radiotherapy. A total body radiation can damage the gonads, or a cranial radiation can cause hypogonadism, or even the uterus gets affected with radiotherapy. So as per the American Society of Clinical Oncology, healthcare providers need to address the possibility of infertility as early as possible, even before the treatment starts. But there have been many barriers to fertility preservation at different levels which need to be addressed. So, a survey on healthcare providers showed that though they know that they need to discuss about fertility preservation, they were not equipped with knowledge. So, a checklist or algorithm could probably help address the ambiguity. A survey on the patients revealed that if they were given better information, it had a positive impact on their decisions on fertility preservation. So, fertility preservation could include a surgery where you could be a conservative surgery in ovarian or cervical cancer wherever it is feasible. You can decrease the risk of radiation by pelvic shielding or ovarian transposition or use of GnRH analogs, but the gold standard remains cryopreservation of tissues. So the tissue that has to be cryopreserved depends upon the age of the patient, availability of the partner, and availability of time before you actually start the treatment. So cryopreservation of embryos and oocytes remains the standard of care wherever possible, and newer stimulation protocols like the random start have decreased the time for stimulation, and wherever there is a threat of hormone sensitive breast cancers, now we have natural cycle IVF and milder stimulation protocols in place. And when time is the problem, we can think of even retrieving mature oocytes and going for in vitro maturation. And ovarian cortical preservation is now no longer considered experimental as per the American Society of Reproductive Medicine. So, prepubertal fertility preservation among the males still remains a challenge, but pubertal and adolescent fertility preservation is a very promising thing. And social egg freezing has gained a lot of media coverage with many celebrities endorsing to this. And a woman's struggle is always limited by the continuous ticking of the biological clock. We all know that at the age of 30, a woman has only 12% of her reserve remaining, and at the age of 40, she has only 3%. And as age increases, the risk of aneuploidies also keeps increasing, with only 1 in 900 at the age of 30 suffer probability of Downs, which increases to 1 in 100 at the age of 40. So this further reemphasizes that whenever a woman wants to postpone pregnancy, she has the option of social egg freezing. So there are a lot of options, there are a lot of reasons for social egg freezing, be it education, career choices, not finding the right partner, not prepared for parenthood. But there still are a few words of caution, like there are so many safety and ethical concerns related to fertility preservation. Of course, long-term studies on the health risks associated to cryopreservation have been quite positive. Stem cells differentiating into germ cells could be the way forward, which could replace the preservation techniques and the need for gamete donation, but this is currently not the mainstay of treatment and requires rigorous clinical trials. So we need to bridge the gap between oncologists and fertility experts, be it the information, the data, the option gap, and various fertility preservation societies. Developing international registries on fertility preservation outcomes is the need of the hour. So Mr. and Mrs. A opted for semen banking for their son. Ms. B and C opted for oocyte cryopreservation. Mrs. D opted for embryo cryopreservation, and Ms. E went for social egg freezing. So together we should all join hands to empower people to take charge of their lives. Thank you so much.
Hello. Fantastic. Congratulations. She had won the Jaideep Malhotra Oration. And just a thought for you, Dr. Sherman Silver, my dad's friend, and there's a lot of work going on conversion of skin cells and reversing them to induce pluripotent stem cells. And one of the thoughts when we were discussing it in a conference in New York was that in the future, when that becomes a possibility, which has already become in the mice, you will preserve fertility in the form of skin. And you need to preserve it at the age of 20 because the telomere shortening takes place as you age. So the future of fertility preservation would be preserving skin at the age of 20. So that's maybe the future.
Thank you very much.